For this occupational therapy portfolio topic, I'm going to be walking you through a patient's occupational profile, and I'm going to be relaying it to you as if you are the doctor. So, our patient is seeking help from occupational therapy to improve right wrist pain, which they rate a 7 out of 10, and right wrist weakness. Client states that this pain and weakness interferes with lower body dressing, sleeping, taking care of their children, showering, cooking, and using the bathroom independently. Client says that the pain has been consistent since an incident they had 2 months ago, and overall client wants their independence back. So our client feels successful in upper body dressing, driving, and cleaning. The only barriers noted are pain and weakness. Our client's personal interests and values are that they are a stay-at-home mom while their husband works. Therefore, they value independence with ADLs and IADLs heavily, since they are home with the kids by themselves often. The client values leisure time with their kids and husband, and client attends church every Sunday morning. For our client's occupational history, again, our client is a stay-at-home mom. She's been married for 3 years and has 2 children under the age of 3, and has recently moved to Ohio from Kentucky to be closer to family. Has a large family network, but a small network of friends. For our patients' performance patterns, which include their routines, roles, habits, and rituals, our patient's roles are a mother, a caregiver to her children, and a wife. Her routines include preparing breakfast, lunch, and dinner for everyone, playing with the children, putting both the children down for a nap, watching TV and reading books, and putting the children to bed for the night. Our habits are, our patient takes ibuprofen for the pain, but claims to have a habit of ignoring the pain, as sometimes she still believes she can perform all the day's necessary activities, even though they're experiencing pain. Our patient's rituals are they attend church every Sunday, and our patient does not like to miss it and hopes that this eventually doesn't start to interfere with their ability to do so. Okay, so some supports and barriers associated with our client's environment and context. First, we'll start with physical environment and supports. Our client's house is not too big, and it does not require a lot of cleaning. There are stairs, but the stairs have a left-hand rail, so they do not have to use their right hand for this. Some physical environment barriers are: the patient describes their kitchen as being large and requires a lot of moving around and carrying things far distances, placing a strain on the client's dominant right wrist. For our social environment, some supports. The client claims that her husband is very helpful and helps whenever possible. Since the incident, the husband has taken on as many of our client's routines as possible, so cooking when possible, changing diapers when possible. And some social environmental barriers are our client's husband does landscaping, and so is gone for many days of the week and many hours at a time. So now we're going to look at cultural context, some supports. The client has a couple friends in the church community that are also women and are willing to help out with the kids when needed. And some barriers are the client's religion believes that the woman is supposed to take care of the house and the kids, Therefore, sometimes our client feels a bit judged in their current situation, requiring more help from their husband in these aspects. Personal context, some supports. Our client is a 27-year-old female. She's highly educated. She says that they are typically middle class socioeconomic status, but are currently fallen on hard times due to COVID-19. And these barriers of being lower SES due to COVID-19 means that our client is unable to buy any equipment if recommended for her treatment. Some temporal supports is that our client is young and healthy. The client does not want to miss out on being in their children's lives during these important years and is willing to work hard in OT to do that. Our client definitely seems to be willing to put in the effort, as she sees it very important to be there for her children in every way that she can. Some temporal barriers is that our client is juggling many difficult aspects of life right now and is concerned that their health will be pushed to the background. Again, our client has discussed occasionally not taking ibuprofen even while experiencing pain, because they feel that they're too busy and they just kind of forget to do it. So our patient, yes, definitely believes that they're pushing their health to the background, and it'll be important for us to address that. Some virtual contact supports. Our client uses a cell phone mainly to connect with people and baby monitors to keep an eye on the children while they're sleeping. Other than that, doesn't appear to use any technology out of the ordinary. Some barriers for virtual is that our client is right-hand dominant and says that using the phone in the right hand is exhausting and painful sometimes, but that it is too awkward to use in the left hand. And our final findings is the client goals. Our client wants to improve lower body dressing, cooking, and using the bathroom with decreased wrist pain. And our client wants to improve life satisfaction with house management and taking care of their children. And this is my client's occupational profile.